Good afternoon, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We are coming to you an hour later than normal just because we had a separate press conference because it's so hot. There's a heat advisory, and it was really important to get some messaging out so people know what to do if they need to get cool today when we're having such hot weather. So as always, this is your chance to get your COVID questions answered. You can see we have not one but two guests here today, and I'm really excited to introduce them. As always, you will be able to put your questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. And those of you who have been following along for the last year and a half know that we've had a number of healthcare providers on. We've had nurses, we've had doctors, but particularly now that we're in August and heading towards school, we're going to be having a lot of focus on kids and on return to school over these next few weeks. So next week, next Tuesday, we're planning to have Dr. Torres from Chicago Public Schools, you know, the leader there, to come and talk about that. So we'll do some more of the CPS specific questions next week. But I wanted to bring in a pediatrician, and as some of you know, I am a licensed pediatrician. I still see patients weekly, but the patients I see at this point are adults because I see both adults and kids. And I wanted to bring someone in who is really seeing kids full time as a pediatrician and answering Chicago area questions from parents and from their kids, and has been for a year and a half. And so, because this is the pediatrician I talk to the very most, she is invited. This is Dr. Abigail Hodges. She also happens to be my sister.
So cool.
So cool. And then this is her son. Do you want to introduce yourself?
I'm Isaac. I'm 8.
Yep. And this is one of my 6 nieces and nephews. I don't have any kids myself, but I have 6 nieces and nephews, and you're the second oldest, right? Yes. I think so. And so, the same advice that I'm giving to all of you is the same advice that I give to my family. But Abigail and I talk, about COVID sort of from a pediatrics perspective. And then a lot of these same questions about schools and masks and all of that is something that we talk about within my own family. So thank you to both of you for joining. And just to start out, so Abigail, can you tell folks just a little bit about your practice, your work, the kinds of questions you've been getting, and then we'll do a little bit of data and come back directly to your questions.
Sure. So thanks for having me here. It's very exciting. So as Allison mentioned, I'm a pediatrician, so I take care of babies all the way up to 18-year-olds. And this last year and a half has been very strange. And a lot of what we do in our office partly has been encouraging patients to still come in for their regular visits. So during the hardest times of COVID, we pretty much were only seeing newborns and young babies who needed their shots. But we've really encouraged, as things were getting better, everyone, if you haven't been to the doctor recently, call up your doc or your healthcare providers and get back in. We've been doing lots of catch-up shots, people who may have missed visits. So I'm doing a lot of visits of, hey, haven't seen you in a year or two. What's going on? How did you make it through school last year? What activities are you doing? So we've spent a lot of effort trying to keep the normal healthcare things going, because that's really important, but also helping families navigate illnesses during COVID. Even a normal cold can be pretty scary right now. And so a lot of our job is helping families talk through what you do when you're sick, what you do with school decisions, daycare decisions. And those are a lot of the questions that we've been getting. And if your child is sick, we take care of kids who are well and who are sick. So we do lots of COVID testing in our office. We have rapid COVID testing. We have PCR testing. And we take care of kids who have had COVID. Thankfully, none of my patients have been very sick with it. One of the biggest blessings for a pediatrician in this pandemic has been that most kids do really well. It's kind of a cold for them, and thankfully it's more the big people in their lives. I have had patients whose parents and grandparents had very severe difficulties with COVID, so I've talked through the emotional impacts of that with a lot of my patients. But thankfully, all of my patients have done well, and we've had hundreds of kids in our practice who have tested positive. But I haven't had to send any of my patients even to the ER, thankfully. It's more reassuring them, supportive care, and answering their parents' many questions, which is very understandable. So that's been a lot of my job the last year and a half.
Yeah, great. And Isaac, so you talk to me about sort of this last year for you. You were in school. Talk to me about masks. How has it been for you?
It wasn't too hard to wear them. I could do almost everything, and it wasn't too difficult to for sports, you could just do it. And masks, it would muffle you a little bit. So I had to learn to kind of speak up a little bit when people couldn't hear me. But it wasn't really that bad.
Did it take you a while to get used to it?
At the start of the year, it felt a little bit weird, but later I got more used to it, and then it was feeling entirely comfortable, and I didn't even bother about it.
Yeah, and you were in school in person. Like, remind me, I think last spring you were out for a little while, and then you were
And then I switched schools so that I could go in person.
Yep.
And I was in person the last school year.
Yeah, and were you wearing masks like that whole time?
Yes, the whole time except for lunch, because you can't wear a mask when you're eating.
Yep.
But that was the whole time.
Okay. All right, good. We get a lot of questions in from parents and people wondering about sort of kids and how they do with masks. And so if you've got questions for Abigail, Dr. Hodges, the pediatrician, or even for Isaac, what grade are you going into? Third grade. So questions for a third grader, he can take them directly too. So let's go ahead and turn quickly and just look at what our Chicago numbers are looking like, and then we'll get right into questions. So as always, chi.gov/COVID- is where you're going to pull up your dashboard. And what you'll see here is that our cases are continuing to increase. We're averaging 347 cases per day. That's about 12 per 100,000, and that is going up. But the good news is that our hospitalizations have continued to be relatively low, about 15 new hospitalizations a day, and our hospitalization rate overall in terms of people with COVID in the hospital remains at that lower risk. The ICU remains at the lower risk. We're averaging 3 deaths a day from COVID. You can see we're up to almost 4,300 vaccinations a day, which is up actually quite a bit. It's been nice to see over these last couple of weeks. As Delta has been getting here, a lot of people have been taking advantage and getting that vaccine, which is good to see. Our testing is up, doing about 10,600 tests a day. We typically see that as COVID cases go up. There's more people with symptoms, more people testing. It's exactly what we want to see. And our positivity is at 3.8%. So just for some context, you know, if you wanted, you can take a look, obviously, as always, see what the vaccines are looking like for the different groups. We can come back off the dashboard. Just for some context, we are the 4th most vaccinated county in the state of Illinois when you look at fully vaccinated. And we have one of the lowest positivity rates right now. COVID is really surging in the southern part of the state. And, you know, it's the whole state is definitely getting hard. But a lot of the rest of the country, unfortunately, is getting hit even harder. So I am going to pull up just one slide here, which is about our travel advisory. And, you know, every Tuesday we update the travel advisory, and we did add 12 more states to Chicago's COVID travel advisory today. So 31 states, all the states in orange here, are now on the travel advisory. And that does include really the states around us, Indiana, Iowa, Wisconsin. And as a reminder, if you're fully vaccinated, you don't need to do anything if you're traveling, anything different if you're traveling to those states. But please, as always, no matter where you're traveling, even if you never leave Chicago, if you get any symptoms that you think could be COVID, you think it's a summer cold, you think it's the flu, take a COVID test, even if you're vaccinated while we're going through this surge. But if you're not vaccinated and you're traveling to one of these folks, we want you to take one of these orange states, we want you to take a negative test really before you come back to Chicago and or quarantine upon return. And you can see just how much this continues to spread. I wanted to just share one other piece of data here that we've been talking a lot about, and then we'll come and get some of your questions. So we've been getting a whole lot of questions about the Delta variant surge, which is very much here. More than 90%, we estimate, of cases across the US, across Illinois, in Chicago, are now this Delta variant. So one of the important things is we've been looking around the world and around the country at some of the places that have surged with Delta before us. So on the left here, you can see India, for example, this is just showing you from February through to the present. You know, they had a prior surge that was it looked relatively small in terms of cases, although there's so many people in India that even a small surge is a lot of people. And on the top line is their cases, and then on the bottom line is their deaths. And so you can see it was relatively small. And then they had this really, really bad surge with Delta, very, very high cases in the upper left here. And those very high cases in Delta led to very high deaths. And we know that was even an undercount count. And that's because there's very little vaccine in India. Even now, they're only 8% fully vaccinated. And at the time of this surge, they were less than 5% fully vaccinated. In comparison, in the UK, which is another country that is really mostly through the surge, you can see that on the top, they had their cases, the alpha surge, and you can see deaths were high, right, with that alpha surge. But in comparison, the delta surge, which came through and really even more than the US, virtually all the cases they were having were delta. They had very high cases, but you can see the number of deaths were very low. And that's because of the vaccine. And almost all of those deaths were in people who were unvaccinated. So we can come off of the graphics now. And just for some context, across the whole US, we are averaging about 125,000 cases of COVID every day right now, which is a lot. That's where we were last February, for some context. But the deaths at this point are only about a fifth of what we were seeing there, and that is because of vaccine. And so if you have not gotten vaccinated yet, now is really the time. With Delta very much here and cases on the increase, that would be my strongest recommendation. So let's go ahead and turn and get into your questions. All right, lots of things coming in already. Where shall we start? We'll start with Alexandra Deanne from Facebook, who's writing in saying, I saw a report recently that kids are getting COVID at a higher rate with the Delta variant. They may be getting sicker. Is that true? What do we think about school? She's got a second question too, but we'll start with that. So I'm going to start with that, and then we'll turn it over. So we are seeing more children comparatively get infected at this point, although actually our rates in Chicago look good right now compared to the older age groups, but particularly in the South where vaccination rates are quite low, and Florida, Louisiana are both breaking their records in terms of number of COVID cases and COVID hospitalizations. They're seeing more younger people, but that's because kids haven't had the opportunity yet to be vaccinated. I haven't seen anything really convincing that it is making kids sicker, like the variant itself. We are seeing more children sick just because it's more contagious and again are less likely to be vaccinated. But I think one of the things we're still learning about is related to the outcomes. The good news is, just like in the other types of COVID, when kids do get COVID, the huge majority of the time, as you said, they have a relatively minor case. So anything you want to add to that? And then talk just a little bit about, she's wondering about how are we thinking about school in the context of COVID?
Sure. So I get a lot of questions about the Delta variant, of course. And the main message that I have learned and that I pass on to families is that it is more transmissible or spreadable, but it is not more severe in most cases. And as Allison mentioned, getting vaccinated is the most important thing you can do to protect yourself, that even if you do get COVID, if you're vaccinated, we do not expect a severe course for you or death. That is the most important reason to get vaccinated, is that even if you were one of those breakthrough cases and you were vaccinated, it should not be as severe. And so true with kids, the Delta variant is affecting everyone, so we are seeing more kids getting COVID now, absolutely. We're seeing a lot more positives at my office, but they're not more sick than they were before. And being in school, to me and my pediatrician colleagues, is one of the most important things for kids, both for their education and for their mental health. So we have really felt like when you look at the risk-benefit of, yes, some risk of being exposed to germs, including potentially COVID, going to school, versus children staying home and missing out on social opportunities, mental health for them, fun activities, and their education, that to us has been very clear this whole time that we've wanted kids to be in school. And I, from a personal experience as a mom of 3 kids, Isaac's my oldest, he's going into 3rd, and I have 2 other kids who are going to make an appearance later, going into 1st grade, and a preschooler who is 3. We felt what remote learning was like in that first spring when the pandemic started. And it was a hot mess for all of us. And I know the schools were trying to figure out what to do, and these teachers were absolutely doing their best. And I gave them so much props, really, and the principals, trying to figure out what to do when all of a sudden overnight we were home and they're trying to dispense laptops and iPads, and we're trying to figure out how to work from home. My husband is a college professor, and he's been teaching at home the whole school year out of our playroom. I was a doctor still going into work the whole time. Our office never closed. But we went through that spring, and then that summer, I was like, if there's any way we cannot do that again, I really want our kids in school, because it affected them a lot. They're young kids. They should be playing and doing activities and being with friends. Sitting home on a couch in front of a screen is not natural for young kids. It's actually really developmentally inappropriate. And if it was the only option, fine. If it's what we had to do, fine. But I had the option of looking around at some other schools, and I actually switched my kids' schools for the fall, so both of them were able to be in person. Not everyone was able to do that, I understand. But even those who weren't, I was an advocate of trying to get schools to reopen sooner and move, so his buddies, many of them who stayed home, were able to eventually go hybrid, and then the end of the year, or in spring, whenever it happened, when your besties went back, then they were able to go back to school regular in person. And we see so much as pediatricians, when kids are able to go back to school, they start to light up again. They start to have fun and smile, because kids feel stress. Even if we say, oh, you're gonna be okay if you get it, they're worried. Kids are having lots of anxieties, and they're feeding off their parents, who are appropriately scared. And so we've dealt with a lot more mental health struggles of children and teens who were home this last year than I have ever in my practice. I've been a doc for maybe 10 years. So being in school is such a tangible thing that to us is so important, not just for the education, but having that routine, getting up, brushing your teeth, getting dressed, going to school. Even if you have to wear a mask, I don't think that is a big deal. I think kids can have a full school day experience. They can have recess, gym, sports, and that to me, I mean, I don't know, did you feel like school felt very different last year?
We got a question for Isaac coming in. Christina Judge is her name on Facebook, says, question for Isaac. Would you rather go to school but wear a mask all day, or learn from home so you don't have to wear a mask?
I would probably rather go to school, because at home I couldn't play with anybody. I was just on a couch in front of an iPad, and I couldn't really do anything. Even though I didn't have a mask, that didn't change the way. I was kind of really bored, because every day I just keep doing at home, open up the iPad, get on this Zoom meeting and do it. But in person, it was so much better. I was having so much more fun. And the mask, later in the school year, I just got comfortable with it and didn't even care about it. So I was really excited that I got to go in person.
Yeah, and some of your cousins did it. Like Drew and Allie, who are cousins. One's 1 year older than you, and one was in kindergarten. And they were in a virtual school environment that whole year. And everybody's having to sort of different options. But one of the reasons that we at the Chicago Department, thank you for that, good answer. One of the reasons we at the Chicago Department of Public Health, were advocating so hard for in-person education was that we saw the data that schools could be open even before vaccines with appropriate mitigations, things like masks and pods and testing and contact tracing and all of that. And it doesn't make for a normal year necessarily, but we felt so strongly, it's not just about the academics, but it's about the social and the emotional learning. And once we saw, we did a big study here because the Archdiocese in Chicago was open throughout the year, and we did not see higher rates of COVID among the kids or the staff in those settings than we did in the community. And then obviously in the spring, we're able to come back with Chicago Public Schools and not seeing outbreaks in that setting. With vaccines on top of that, that adds, of course, another really important layer of safety for staff and for those older kids. And then, once vaccines are available for the younger kids, that'll be there. All right. Okay. Tiffany Hagstrom on Facebook says, this is for us, the timeline for getting children a COVID vaccine seems to be changing. What are you hearing? Can you provide some clarification? What are you hearing?
Sure.
And then I'll tell you what I'm hearing.
So I am so eager for the young kids to be able to be vaccinated. My 3 kids will absolutely be, not the front of the line because I'm fair, but they will be in the group of getting everyone vaccinated at my own practice. We did all of our 16 and ups when it was approved at our office. We did the 12 and ups. We were actually vaccinating adults before even kids had a chance. All of my pediatrician colleagues, we volunteered and helped give shots through the health department, and we were doing them at our office as well. So we were all very excited to vaccinate. The next age group down, it sounds like will probably be the 5 and ups, the 5 to 11s. And back a few months ago, we were hoping that might be in September. That was really what I was hoping, because it sounded like near the start of school year. And now that's been pushed back a bit to more like late fall, early winter, perhaps it's the next group. And part of that, in my understanding, is wanting more kids in these studies. So they asked for 3,000 more kids to be enrolled in the Pfizer and Moderna. I tried to sign all my kids up for studies. They didn't get in. Some of my patients got in. So I have some young kids who have been vaccinated, and that's really cool. But they wanted more safety data and more months of data to watch for safety, because obviously kids are not just little adults, they're different, and we want to make sure all that safety data is there. And the rigor of these studies is significant. They're not just saying, oh yeah, it was good for the adults, sure, let's cut the dose in half and give it to the kids. That's not at all what's been happening. And they want to be careful, and that helps me feel better recommending it to families, and families to hopefully feel more comfort in that, knowing that it's gone through a rigorous process. They even asked for more data to be brought in and more months. I saw somewhere about adults having kind of 2 months. For kids, they wanted more 4 to 6 months of looking at data. And partly that was delayed because we did see some cases of viral myocarditis or some heart inflammation in some of the teenage kids. Most cases, there were very few, and most were self-limited, and they got better in a few days. But that was something that was like, okay, we need to make sure we look into this, make sure we feel comfortable, kind of like there was a pause with the Johnson & Johnson vaccine along before. They said we want to make sure we're good and we move forward. This has been a case of wanting to make sure we feel safe and what the appropriate dose is for kids, because it will be less than adults, and they're still trying to figure that out. But as soon as it is available, which now looks like it will be a bit later this year, but everyone will get a turn, and probably 5 and ups, then maybe 2 to 5, and then maybe babies 6 months and up. But we're waiting to hear about that. But we are very eager. I've got the Pfizer in my freezer. I'm ready to give it. I mention it at all well visits for kids, saying we'll be contacting you later this fall or winter. We do shots clinics and evenings and weekends, so it's easy to get in. But that's why there's been a bit of a delay. And believe me, I want it to come through as soon as it's safe to do so. And I know the American Academy of Peds has been trying to petition as well, the FDA, make sure this is a high priority. We got to get these kids vaccinated as soon as we can. And so I hope that's coming soon.
All right, good. Lots of things coming in on both Twitter and Facebook. So at Pandemonium4942 on Twitter was asking about updates on vaccines for under 2. I think that's going to be early next year, most likely. But also this person is asking any info on breast milk offering some protection if the mother is vaxxed or anything along those lines. You want to start that?
Yeah, so that's been one exciting way of actually a way that a lot of young babies are able to get some protection. Yeah. So most kids in my practice under 12, well, nobody under 12 has been able to be vaccinated, and they really want to be. We got a lot of parents who are like, my 10-year-old's tall, my 11-year-old's tall, can you sneak them in? No, I can't. I follow the rules. But absolutely, so we know that breast milk can pass antibodies from the vaccines. So moms who were able to get vaccinated when they were pregnant and in those first months when they're breastfeeding, or if for several months if they breastfeed, they've shown studies of testing the breast milk. It's really cool pictures to see. They drop the milk on and they test it, and there's clear antibodies against coronavirus. So moms who are able to breastfeed and choose to can pass that to their babies. So that I have many families, actually the baby has a little more protection than the older kids do. And I've used that as a way to help convince some parents who are on the fence. There were some moms who, when the shot first came out, weren't feeling comfortable when they were pregnant being vaccinated. And we have shown that it is safe and advisable. OBs are all recommending it. And I, as a pediatrician, recommend my pregnant moms to do that, because pregnant women are higher risk for having complications with COVID, potentially having preterm labor and consequences with that. But I have had moms with young babies who say, you know what, I'm nursing, but I'm going back to work in a month or 2. I'm not sure if I'm going to keep nursing. I still never got the COVID vaccine. I'm not sure if there's a point to get it now or not. And then I mentioned, well, actually, if you get the vaccine now, you could give some protection to your baby before your baby starts daycare at 3 months. And that's a really good thing you could do both for you and your baby. And that has made some moms think about it. And I've had some moms get vaccinated, and many of those at our office. Maybe they feel more comfortable at the pediatrician's office because I have a trusted relationship with them. Hopefully that's also elsewhere, but that's a real perk. And I do have some moms with kind of funny stories saying, if I know this breast milk has some antibodies, can I give it to my big kids? And it's been a really funny question. And we don't really have any scientific evidence of how much breast milk to give, but I do have moms who are like putting some of their kids' oatmeal in the morning and be like, maybe this helps. It doesn't hurt, but it's been pretty funny. And some big kids are like, Mom, what are you doing to me? That's for the baby. It's kind of funny. Peds is a funny world, though.
It is. And I would just add, it's similar to influenza. So we really work hard to make sure that women who are pregnant during influenza season get vaccinated, because they are able to, not just with breastfeeding, but when they themselves are protected, they can pass on some of those antibodies. And just to be very clear, when we're talking antibodies, that's the protection for COVID. That's not COVID itself. You don't pass on COVID through the breast milk. You pass on the protection that you've gotten if you've been vaccinated. And so just like for flu, those babies under 6 months who are too young to be vaccinated get some of that protection from the mom. We're seeing the same thing with COVID. All right, good. All right, we got some more about school and some more for you, I think, Isaac. So at Lily MW on Twitter is saying, if Delta is 2 times as transmissible, and it's unadvised to be unmasked within 6 feet, how will children under 12 be able to safely eat at Chicago Public Schools? So be able to safely eat lunch. Again, every school is going to be different, but why don't we actually start with this sort of safely eating question? Because we know you got to take your mask off to eat and drink. So let's actually start with you on this. So you were in school last year. What was lunchtime like at your school?
If the sky was clear and everything was good, we'd often eat on the playground, sometimes on the steps of the school. But if it was raining or snowing, if it was raining, if it was really pouring or there was a thunderstorm, we'd be inside and just be careful. You couldn't get up out of your seat. You would have to tell the teacher before you do that. And
you spread apart 6 feet. And they actually showed a movie during those days to discourage kids from talking or being up and around, because I was a lunch helper sometimes. So on those, if it was less than 20 degrees or storms, usually they would be inside, spread apart.
But we'd always try to be outside. And sometimes even if it was lightly raining or even hard, but it wasn't a thunderstorm, so we didn't have to be inside, we'd sometimes, there's a parking garage right next to our building, and we'd sometimes pick 1 or 2 or 3 sometimes parking spots and just spread out and eat lunch in the garage.
On the floor of the parking garage?
Yeah, because then we wouldn't be getting soaked with rain, but we could still eat outside.
And be spaced.
Yeah.
Yep, I got to be the lunch helper one of those rainy days, and they would hand me a bag, and there were colorful dots, and the parent or the lunch helper or the teacher would spread the dots apart by 6 feet. We usually went to the 3rd floor of the parking ramp because they gave everyone different areas. And then I would hand everyone their milk and squirt Purell on everyone's hand and then spread out, and we'd sit and eat our lunch. And it was hilarious and just one of those funny COVID moments that Isaac can say he got to eat lunch in a parking ramp. But that's what his school did as creative problem solving. You're like, okay, we know school is a difficult thing. We're not using the cafeteria. We're eating in classrooms spread apart. Or his school, basically everyone was outside, and they assigned everyone different areas. You're over here. You're on the baseball field. You're over by this spot. And they spread everyone out. And it was pretty creative. I did not think that would happen, but I was really pleased with how the kids' schools did. And Isaac even told me at the end of the year, he said he had the best year of school of his life. And I was shocked. And he asked to stay at that school because we had switched schools to have in-person school. And he chose to stay there and he knew no one going into the school at all. And he said it was the best year he'd ever had, which I did not expect. And in a pandemic, that's a real testament to his teachers and the administrators and all those creative solutions that made it possible. And he was lucky that he never had to quarantine. Neither of my boys ever did. Certainly some classes did. He certainly had to get some COVID tests if he had a cold, because that's what we needed to do to keep schools safe and open. Was any symptom, he got his temperature check going in. I had to fill a little thing out every morning that my kids didn't have symptoms. And if they did, I had to keep them home and get a COVID test before they would go back. So I brought him and his brother to my office a few times when they got a little cold, tickle the nose and make sure it's good, get a note, go back to school when his symptoms were better. I didn't send him back when he was still sneezing or coughing on everyone, just to not spread normal germs around, because it wasn't a really fun year to have a cold. But that was what we needed to do. And the school was very strict about that. And that's partly what helped the school stay open all year. We thought maybe we'd have to close at some point or go all virtual, and they didn't have to. So that was really wonderful.
Yeah, lots of creative problem solving. And we'll talk specifically about Chicago Public Schools when we do that next week and some of those plans. But there are very specific plans around lunch in every school, and there were last year too. Okay, lots of questions in here about how should we teach kids to keep their masks on. So Isaac, do you have any suggestions? Maybe we'll start with you, and then I'm sure you get this at work.
To keep masks on,
yeah.
It's often just if you don't want to just immediately start with a long time with a mask on, because before the school year, I would have a lot of trouble with masks before the school year, but we practiced at different stores, like if we were gonna buy something, I might come along to practice with masks, and like sometimes we'd practice like, hey, can you wear this mask for 10 minutes and let's see how it feels, and we'd just get used to it after that little bit of time and be able to actually wear it the whole 7 hours of school.
Yeah.
And do that.
And were you wearing it that whole time in school? Yeah.
Wasn't too bad for me, so I was glad, even though I had to wear one, it was in person and I was having fun.
Yeah, good.
And we always had backups too, so a lot of kids would switch halfway through the day or after recess. If it got all gross in there, we always had lots of backups. Partly it's about finding cute masks that are good. So Isaac is a big sports fan, and we tried many different masks for my 3 kids to find ones that fit. It was very much harder than just normal back to school shopping. So different styles. Isaac liked the one with the little kind of nose clip, so it doesn't fall down. And you know, my 3-year-old wanted all different animals and monsters, and she might come on later and show you one of hers. Whereas my son is about animals, so he had penguins and dolphins. So partly being cute helped some, and trying different ones.
Frozen masks, very popular.
Yes, you can. At my office, I see very many cute masks. And partly it's, if the expectation is your kid is going to wear a mask, they will learn how to do that. And practicing, as Isaac mentioned, for shorter increments, not being home and saying the first day of school, here, put this on all day, but practicing like going into a store. If you're going to go just buy 1 or 2 things and the kid wants to come along, because right now it's really exciting to go to the grocery store because a lot of kids don't get to go along. But early on in the pandemic, when kids had to wear masks at the playground, that's a lot of how I taught my then 2-year-old how to wear a mask, because she wanted to play at the playground, but the rule was you have to wear a mask at the playground. So just like teaching her that she has to hold my hand when we cross the street, I'd say, okay, we're going in, but if you take it off, we have to leave. And so she'd play for a minute or 2, pull it off. Okay, we're gonna leave. No, I wanna stay, Mommy. Okay, we have to keep this on. And eventually she learned. And I would reward her and praise her, just like potty training, M&Ms, stickers, prizes, all this stuff of what you can do if you're able to wear a mask. And it's also modeling it as parents. Yeah. If we show, this is not a big deal to wear it at the grocery store, you put it on, we get our stuff and we go, then it's not something that becomes a big charade. So absolutely, if the expectation is there and you find ones that fit your kid, whether it's the disposable ones or you find different cloth ones, I had neighbors who were making them with all kinds of cute patterns.
We've even had, sometimes some folks like to use the disposable, the ones, and they let their kids color their own masks or put a design on them. That was something we had someone come on and talk about.
Yep, Isaac's school, both of our boys definitely got to color masks. They had a walk-a-thon at school and everyone decorated them. Birthday masks. There's a lot of fun you can do.
So multiple questions on here about what do you think about kids or adults who have underlying medical conditions? Should they be coming back to school? Should they be getting the COVID vaccine? I'm sure this is something you get questions about, and we certainly do, and I'd love to hear kind of from your perspective. I know you see kids with a lot of underlying conditions. What have some of those conversations been like?
Sure. So I feel strongly enough about in-person school that I have 0 patients currently that I'm recommending not going to school, and and or not getting the vaccine. So all of our patients, be they healthy children with no issues, kids who have had cancer, even ones undergoing cancer treatment still are advised to get the vaccine. But children with congenital heart problems who have had heart surgeries, those children, for the most part, have been in school and certainly are going this fall. And I have had families also, after my recommendation, go and check with their cardiologist, their heart doctor. And I encourage them to do that. Ask people, make yourself feel more comfortable. But the most common childhood health condition is asthma. Isaac has asthma, or as we call it, the big coughs, when he was little, because him compared to his brother or sister, if he gets a cold, he gets a bit deeper coughs, and it lasts a bit longer. And we have a couple different inhalers or puffers that he uses. He used to call it his oxygen tank, because with the spacer, it made him look like an astronaut, which made it cool. But Isaac knows that when he gets a cold, sometimes he maybe misses an activity or two, or it takes a bit longer for him to kick the cold than his brother or sister do. But he's got his inhalers, and even with COVID, I know that children with asthma are not at higher risk of having more difficulties with COVID. They're not. The main reason of more risk, more for adults, is people with immunodeficiencies, if their body wasn't able to maybe make a full immune response to the vaccine. So I have parents of kids who have had transplants, or reasons like that, that they're more worried they're not feeling as fully protected.
Yeah. And just to be clear on that, so like for example, we get a lot of questions about immunodeficiency, and the thing that we've been learning is that there are some people who have pretty severe immunodeficiencies, like if they're transplant or cancer therapy, where their response to the vaccine might not be as strong. They might not have as much protection, but still the recommendation virtually all the time, is really to get that vaccine.
Right.
So, with asthma or the big coughs, did that make the mask harder? Do you remember like any issues?
No, even with colds, and if I had to wear a mask at some times, it didn't do much.
Okay.
I was coughing a little more, but wearing a mask didn't do anything, and having that didn't block anything and make it harder.
Yeah, okay, good. And that's, and what we do see, and we still sometimes get people who, are reading information, they think that the carbon dioxide is higher with a mask, which it's not, or that there's breathing problems with a mask, which there's not.
And even running. Isaac plays soccer and baseball. He would have 3-hour soccer practices last summer in 90 degrees, and everything was masked last summer. And he would wear a mask for 3 hours. He'd be so sweaty. His mask, he would sweat through and switch to a different one. But he never had labored breathing, and none of my patients did either. So there wasn't any recommendation to either not go to school or be at higher risk because of asthma, which is one of the most common, as I mentioned, childhood conditions. So no, I don't have any patients who I'm not recommending getting the vaccine for, and I'm spending a lot of time helping people feel more comfortable about it. So hopefully they can make that decision for themselves. And I have some teenagers who really want it and actually talk their parents into letting them get it, because their peers are getting it and they want to be back to more normal socializing and activities. So I've seen a lot of mature teenagers kind of step up and be a good example for their family, and then it helps their parents or grandparents feel more comfortable.
Good. So a couple of quick ones. Gwendolyn Rose on Facebook said, isn't viral myocarditis a side effect from having COVID-19 as well? It definitely is. And actually, the rate of the myocarditis or the heart inflammation is much higher after COVID in young people than it is after vaccine. The vaccine is low, but as Abigail said, this is one of the things that they've been studying.
And that's such a clear example of when you're looking at the risk benefits. We look at the rates of myocarditis in kids with COVID, still very, very low, but more likely to have heart issues from having COVID than from getting the vaccine. So we're looking at always comparing those numbers. And so absolutely, good question.
All right, we've got Barbara Rachel on Facebook, and Aaron, we'll go Barbara Rachel on Facebook, says, there is no testing for the Delta variant. So how are they determining it's Delta? Isn't it coronavirus? So it is definitely coronavirus. And when you get that test, any of the tests, whether it's the antigen test or whether it's the PCR test, the one where we're testing in the nose, that comes back just as coronavirus, yes or no? But behind the scenes, we are doing extra testing to take the genetic fingerprint of that coronavirus. And with the genetic fingerprint test, which is a more involved test, it takes actually a couple of weeks to run the whole genetic fingerprint for the test, we can see what kind of variant it is. So every single case does not get checked to see what kind of variant it is, but we sample from across the city, across the state, across the country, and every time one of those genomic fingerprints gets taken, it gets uploaded and shared around the world, and we can follow the patterns. And so because the Delta variant is more contagious, it outcompetes the others, and week after week we've been seeing a higher percentage of those coronaviruses that we test having the genetic fingerprint of the Delta variant. So really good question, and at this point, like I said, you know, what we are seeing here and everywhere, chances are very, very good that it is Delta. Anything you want to add to that?
I would just say, right, that's testing happening more as Allison's doing and kind of like at the community level. In my office, it's just yes or no. You have coronavirus or you don't. It's a plus or a minus on the machine. It doesn't make a difference to me if it was the Delta variant, the Lambda variant, or whatever. It's coronavirus. So in that sense, to each individual patient, it doesn't matter that much. And we would never tell a patient, yes, you have it and you have this type. It's not anything like sometimes there's flu A and flu B. Some parents wanted to know which type. It's not anything like that. So to me in my office, it's just yes or no.
Yep. And here's sort of a similar, Aaron Sanders on Twitter is wondering how are breakthrough infections being tracked. He says, it seems there is no standard approach for a clinic to ask. So do you want to talk about breakthroughs and then I'll talk about at the public health level?
Sure. So I will say we have to report every test that we do to the health department, every positive, every negative, what test we did, and all the demographics about that patient. So their name, their address, their race, ethnicity, all those things are in there for every test that we do. And that information is reported on, so that gets faxed every single day. So all that data is there. In my office, most of my patients are not vaccinated because they're under 12. With my 12 and ups vaccinated, we haven't had any breakthrough cases yet. We had at least one kid who right after he got his first dose, he tested positive because you're not fully covered until you get both doses and then 2 weeks later. So that kid was bummed and he was like, why did this still happen to me? But he had just gotten his first dose like on Wednesday and he tested positive and a couple of his friends did too. He was at a social gathering like on a few days later. So he was not fully covered yet. And he still did finish his vaccine series and got more covered. But you still can test positive in between your 2 doses or before that 2-week period after your second dose. So that one wouldn't count as a breakthrough infection there. But certainly with adults, there's going to be more. The shot is not perfect. You know, my shot, I got the Pfizer. It's about 95% covered. But that means 1 in 20. If I'm around 20 different people, 1 of 20 people with coronavirus, one of those times I might get it, but I am vaccinated, and so I am not fearful for my own health for getting coronavirus right now. I'd rather not. I'd rather not miss work and expose my kids and have that big inconvenience, but I'm not worried about severe disease for myself or my husband who's vaccinated, and thankfully our whole family. It helps that Allison is in our family, but we're all pretty wise about that. So we're all vaccinated, so that means we feel more comfortable living our lives a little more fully, like seeing grandparents. Before our mom was vaccinated, we did not see her except outside, spread apart by 6 feet for months and months and months. We literally put her in the yard and put chairs around her, and the kids would play, and she would talk with them, but no one was hugging Gaga, as we call her, for many, many months. But once she was vaccinated, got that second dose, we all got together and have been enjoying our company since because we feel much more comfortable being vaccinated.
All right, so we are just coming up on the end here. I'll just note, you know, behind the scenes, we do match every test gets reported. So from doctors' offices, from laboratories, they come to us electronically. We follow up, as a reminder, every case. We do a case investigation. We do the case investigation, the contact tracing, every positive test in Chicago. We aim to do that, and then we match every single positive case to see in our prior records, did this person person ever have COVID before, because we are seeing some reinfections. One of the reasons it's important people get the COVID vaccine, even if they had COVID previously, is to help protect against, you know, the variants and have a higher level of protection. And then we also look to see every time someone's diagnosed with COVID, are they vaccinated? And if they are, especially if they're fully vaccinated, two doses and 2 weeks post that second dose, or 1 dose if it's J&J, 2 weeks post, we are then doing extra follow-up on those investigation. Those are ones we especially want to get the genetic fingerprint on, and so there's extra work that's happening. But 99.98% just of all Chicago people who have been vaccinated have not had a breakthrough infection, just to be really, really clear about that. These vaccines continue to work really well, and especially for hospitalization and death, it's the most important thing. All right, we are basically at time here. Anything else you would like to add or to say to folks?
I don't think so.
All right. When there's time for a vaccine, what do you think? You want one?
Yes.
Why?
I could do a lot more things, and it would be a lot more fun for me to be able to do that.
Yeah, exactly. And these are my other niece and nephew.
This is Juliet, who is 3, and she's going to preschool this fall, and she's wearing her. You want to show them your cool dinosaur mask? Not so much. And here's Grant, who's going to 1st grade with his penguin mask. So really the message is please send your kids to school. That's where they belong. And please talk to your pediatrician if you have questions about coronavirus, about getting the vaccine, because we think it's real important.
And the most important thing is get vaccinated. You know, if you are around kids, you know, I was excited about having the opportunity to be vaccinated because it meant I could be more around my nieces and nephews, you know, with a lot less concern. And the most important thing, while we're still waiting for vaccines for these younger kids, is for the big people around them to get the vaccine. So thank you very much, Isaac. And thanks to the other kids for listening and being quiet over there while we were talking. And as a reminder, we will have Dr. Torres, who is leading Chicago Public Schools here next Tuesday, answering questions. So thanks again, Dr. Abigail Hodges, one of the many, many, many pediatricians in the Chicago area who have been working super hard to keep our kids healthy, and one of just so many healthcare providers who have been working a whole lot over this last year and a half. So,
and thanks to Aunt Allison for everything you do and for being super awesome.
Absolutely. All right. Thanks very much for tuning in, everybody. We'll be back. We won't be here on Thursday. We're doing a Staff Appreciation Day, but we will be back next Tuesday. Bye-bye.